News 4 is working for your health. It's Black Maternal Health Week, a national campaign focused on raising awareness and driving change around a crisis that continues to impact families across the country. In the U.S., Black women are more than 3 times more likely to die from childbirth-related complications. Joining us now to talk more about this and what needs to change is Dr. Tamika Auguste. And thank you for talking about this issue. Is not only important nationally, but especially here in the DMV. So we hear the statistics every year, but why are Black women dying at a higher rate during childbirth than any other race?
Thank you for having me, Jessica, and bringing this to light and speaking about it. Why Black women are dying more than white women? Well, it's not biological. It's not race, it's racism. When we control for income level, education level, even insurance type, Black women are still more likely to have an adverse outcome.
Wow.
And we know that it is the implicit bias and structural racism that is leading to these outcomes.
And is that going on more in the DMV? Because again, I know the DMV is specifically impacted. Again, is not just a national issue, but here in the DMV, Black women are even more impacted, it seems like.
Yeah, so the national average, just like you quoted, 2.5 to 3 times more likely to die in childbearing, child pregnancy-related outcomes. In the DMV, in certain parts, that number is actually even higher. So this is a problem that is local. This is a problem that affects us here in the District of Columbia, Maryland, and Virginia.
And we know that mental health is a major part of the conversation. What should people know about postpartum depression and anxiety?
Absolutely. Mental health is an important part of this conversation. So I first want to just set the stage. It is okay to have feelings of depression and anxiety after delivery. Your hormone levels have swung high, low, and all the way around. So give yourself a little bit of grace, and it is okay. One thing that I think patients can do is have that conversation with your healthcare provider prior to delivery to say, if I needed mental health services, what resources are available to me? Have that conversation with your obstetrical healthcare provider just so that you're prepared in case that happens. There are resources available, and so it's just a matter of planning and making sure that your healthcare team is aware that you may need them as well.
And very quickly, what can pregnant women do to advocate for ourselves?
Very important is have that conversation. Push the pause button, speak to your healthcare provider and say, I'm concerned. I am concerned about the disparity in outcomes. What is your team doing? Your practice, your department, your hospital? What are you doing to help these disparities? And, your healthcare provider and healthcare team really should be taking the time to listen to your concerns and having that conversation with you.
Thank you so much, Dr. Tamika Auguste, for this important information and for sharing with us today.
My pleasure. Thank you for bringing it to light.